This module talks about the cause of death statistics in India, collected according to the International Classification of Causes of Death, ICD-10. Cause of death statistics in India are important to study, particularly for health administration, in order to undertake curative and preventive measures for various health problems. It also plays an important role in medical research for monitoring and improving methods of diagnosis and analysis. These causes of death are analyzed by gender, age, and geographical area for insights. The medical certification of cause of death, MCCD, are carried out through a particular act called the Registration of Births and Death Act in 1969, certified by a medical practitioner, and it is expected to provide reliable data in order to generate mortality statistics. However, there are, of course, deficiencies wherein representative and reliable statistics on mortality are difficult to ascertain and collect. In part, due to these deficiencies, the special survey of deaths was undertaken in the period 2004 to 2005 as an advanced form of verbal autopsy and was conducted under the domain of the Sample Registration System, SRS. These data on causes of death were collected through forms designed by the World Health Organization, WHO, for tabulation as per what is known and used in India, that the National List of Causes of Death based on 10th revision of International Classification of Disease, ICD-10. This national list is based on the ICD-10 and has major causes groups in it. As per the MCGD, it has been revealed that there are 8 leading cause groups of death in India, accounting for almost 90% of all medically certified deaths in India, including diseases of the circulatory and respiratory systems, which is discussed further in the module. Analysis have also been carried out by sex, by age group, and also by religion.
I am Dr. C.P. Prakasham, retired professor from International Institute for Population Sciences, Mumbai. Module 9, Cause of Death Statistics in India. Learning objectives. In this module, we will learn about cause of death statistics in India collected according to ICD-10. 1. Importance of cause of death statistics in India. 2. Medical certification of cause of death, MCCD. 3. National list based on ICD-10. 4. Leading causes of death in India. 5. Leading causes of death by sex and age group. Importance of causes of death statistics in India. Cause of death statistics plays an important role in health administration. The statistics on cause of death is essential for planners, administrators, and medical professionals in undertaking appropriate curative and preventive measures for various health problems. It also plays an important role in enhancing medical research and is fundamental for monitoring as well as improving the methods of diagnosis and analysis. Also, cause of death statistics is useful for understanding patterns of causes of leading to death by gender, age and geographical area. Medical certification of cause of death MCCD. In India, the Registration of Births and Deaths Act 1969 provides under section 10(2) under section 10(3) for certification of causes of death by a medical practitioner. This is known as Medical Certification of Cause of Death MCCD, which is expected to provide a reliable data base for generating mortality statistics. But MCCD has not taken roots to the extent desired and is thus not able to produce representative and reliable statistics on mortality as part of the vital statistics system. Then the country had decided in early 2004-5 to undertake a special survey of deaths using an advanced form of verbal autopsy. The special survey of death for the period 2001-3 has been conducted under the domain of sample registration system. The assignment of cause of death has been done through a process of medical evaluation by two independent trained physicians. The first report of all causes of death of the country, which provides direct estimates of mortality, is from 2001-3, prepared by RGI, Ministry of Home Affairs, New Delhi. Medical certified cause of death classification in India. The data on cause of death were collected in a prescribed form number 4, institutional deaths, and filled by the concerned hospital authorities, and form 4A for non-institutional deaths. Both these forms have been designed by World Health Organization (WHO). The forms are filled up by the medical professionals attending the deceased at the time of terminal illness. Thereafter, these forms are to be sent to the concerned registrars of birth and death for onward transmission to the Chief Registrar Office for tabulation as per the National List of Causes of Death based on the 10th revision of International Classification of Disease ICD-10. National List based on ICD-10. Major groups 1 to 19. 1. Categories 58. Group of 3 characters categories. 2. Subcategories 177. Group of 3-4 character categories and 3-4 character single categories. And major group 20. External causes of morbidity and mortality 3. Categories 11. Group of 3 character categories. 4. Subcategories 16. Group of 3-4 character categories and 3-4 character single category. Major cause groups. Description and ICD code. 1. Certain infectious and parasitic diseases A00-B99. 2. Neoplasma C00D48. 3. Diseases of blood and blood forming organs and certain disorders involving the immunomechanism D50-D89. 4. Endocrine, nutritional and metabolic diseases E00-E89. 5. Mental and behavioral disorder F01-F99. 6. Diseases of the nervous system G00-G98. 7. Diseases of the eye and adnexia H00-H59. 8. Diseases of the ear and menstrual process H60-H95. 9. Diseases of the circulatory system I00-I99. 10. Diseases of the respiratory system J00-J98. 11. Diseases of the digestive system K00-K92. 12. Diseases of the skin and subcutaneous tissues. 13. Diseases of the musculoskeletal system and connective tissues. M-00-M-99. 14. Diseases of the genitourinary system. N-00-N-99. 15. Pregnancy, childbirth and the puerperium. O00-O99. 16. Certain conditions originating in the perinatal period. P00-P96. 17. Congenital malformation, deformation and chromosomal abnormalities. Q00-Q99. 18. Symptoms, signs and abnormal clinical and laboratory findings. R00-R99. 19. Injury, poison and certain other consequences of external causes. S00-T98. 20. External causes of morbidity and mortality. V01-Y89. 21. Factors influencing health status and contact with health services. Z00-Z9. The causes of death for item 21 has been added suitable to Indian conditions apart from WHO ICD-10. MCCD in India. The cause of death statistics report on MCCD 2014, which is based on 10,66,221 total medical certified deaths, accounting for 20.5% of total registered deaths, reveals that there are 8 leading causes groups of deaths in India. These 8 leading cause groups of deaths contribute around 88.5% of total medically certified cause of deaths in India. Table 1 shows 8 leading causes of death in India collected through MCCD 2014. Among the disease of circulatory system, deaths table number 1, the disease of pulmonary, circulatory and other forms of heart diseases and ischemic heart disease IHD account for 41.6 and 32.7% deaths respectively. The sixth leading cause group, injury, poisoning and certain other consequences of external causes, has a major constituent, burns and corrosions, contributing 19.9% of the total deaths under this cause group and 1.4% of the total medically certified deaths. Under neoplasma cancer, which is the seventh leading cause among the total medically certified deaths, of which malignant neoplasma of digestive organs account for 24.9% of deaths. Death by age in India, MCCD data. Cause of death in India during 2013-2014 by age wise is given in figure 1. According to MCCD data, it shows that infant mortality is high and later mortality decline up to age 1 to 4. Later percentage of deaths increases by age up to 55-64. Later increases beyond 70 plus. There is a dip in age specific deaths in the age group 65 to 69 years, and it may be due to error in age reporting, and it has been smoothened by using linear regression starting from origin, shows y equals to 1.779x with r square equals to 0.551. Distribution of medically certified deaths in India 2014 by sex. From the above chart, it was evident that at old age and infancy, mortality is higher and males mortality is higher in age group 60 to 69 and 70 plus than female. Cause of death by age group, infancy. And as an illustration, the cause of death in India during 2001-3 by age wise 0 to 1 and 1 to 4 years is given in table 2. Out of 10 leading causes, perinatal condition 46% shows table 2, highest percentage among infant 0 to 1, followed by respiratory infection. The third leading cause is diarrheal disease. In case of children 1 to 4, around 24% deaths are due to diarrheal diseases, followed by 23% respiratory infection. Deaths due to malaria occupies 9th leading cause among infant 0 to 1 years, whereas it occupies 5th position for 1 to 4 years children. Causes of death, other age groups. In the age group of 15 to 24 and 25 to 34 years, major group injury, poisoning and certain others. The consequences of external causes is the first among the leading cause, contributing 26.4% and 20.7% deaths respectively. It implies that these age groups of youth and adolescents are more vulnerable to injury and poisoning related deaths. In the age group 35 to 44 years, the first two leading causes, diseases of circulatory system and certain infectious and parasitic diseases, are having the shares of 25.4% and 17.1% respectively. For all the age groups of 45 years and above, disorders of circulatory system is the first leading cause of death. The percentage contribution of this causes group for 45 years and above, the respective age groups totals has been increasing with age. The percentage share of this cause group to the total medically certified deaths for respective age groups varies from 33.6% to 44.2%. Causes of deaths by sex, MCCD data. Sex-wise variations exist in causes of death in India. According to medically certified deaths by sex reveals that diseases of the circulatory system I00-I99, symptoms, signs and abnormal clinical and laboratory findings not elsewhere classified R00-R99. Certain infectious and parasitic diseases A00-B99, diseases of the respiratory system J00-J98, certain conditions of originating in the perinatal period P00-P96, injuries, poisoning and certain other consequences of external causes S00-T98, neoplasma, C00-D48, diseases of digestive system K00-K92, identified as 8th leading cause of death. These deaths by cause account for about 88.6% of the total medically certified deaths. Table 3. Causes of death by state is given in the following graph. The percent registered deaths to total deaths shows that in Goa the percentage is high, 99.5%, and in Jharkhand 0.8%, West Bengal 1.8%, followed by Chhattisgarh, Madhya Pradesh, etc. This percentage of registered deaths to total deaths revealed that the accuracy of death registration and coverage error of deaths by cause under MCCD. Coverage error equals to 100 minus MCCD deaths divided by total deaths. In Jharkhand, the coverage error is 99.2, that is 100 minus 0.8, and in Goa it is 0.5. Questions. Number 1. Describe the importance of cause of death in mortality studies. 2. Describe the national list based on ICD-10 major groups adopted in India. Number 3. Describe the complete list of medical certified of cause of death adopted in India. Number 4. Describe briefly the variations in deaths through MCCD in infancy by sex. Fill in the blanks. References. These are the following important references one can read